There are many factors, but for sure, number one, you need to have the correct diagnosis. Clearly, you need to have a good diagnosis. Or in other words, you need to have the diagnosis who is appropriate for an indirect pulp cap, which is reversible pulpares. Number two, part of the diagnosis, before I move into number two, you need to do a good oral exam. You need to look at the patient and you have a good interview with the patient to understand a little bit about the symptomatology, how often the pain and all these things. The next factor is to look at the radiograph, to have a really good evaluation of the radiograph and look how deep is that cavity. If the cavity seems to be too deep, too close to the pulp, likely, as I said, radiographs underestimate how deep is the decay. Likely the decay, which means all the bacteria, they are all having a party already in the pulp, so that too is probably not a good candidate for indirect pulp cap. There are other factors related with the patient age. Children behave like children. And as a pediatric dentist, I see kids all day long. I don't expect that a kid who is 3-year-old is going to behave like somebody at my age. And so the patient age plays a role because I need some patient cooperation. I need to understand a little bit more about the pain. And if I have a 4-year-old, believe me, they are not able to really tell you all the details about the pain. Close to my graduation from dental school, around that years, indirect pulp cap was not an option. We didn't have a material who will give us all the properties that we really wanted to be more successful doing indirect pulp caps. In these days, Biodentine and tricalcium silicate is probably the most important factor, well, after looking at the diagnosis and looking at the other factor that I just discussed with you, that is going to help me to the success of that indirect pulp cap. Biodentine is an excellent material that is going to give me all the properties that I wanted in that deep cavity that I'm going to do an indirect pulp cap that I decided is appropriate based on the diagnosis and everything else. Biodentine is going to give me everything that I needed. You know, I use Biodentine for the indirect pulp cap. That means that Biodentine is going to be in close contact with the floor of my preparation. But also I use Biodentine as a bulk. I'm going to use Biodentine as a true dentin substitute. All the implications of dentin substitute means that I'm going to use a material that is going to provide me the chemical and the mechanical properties of the dentin, and is going to allow me to fill that prep with a material full of properties that they are going to help me in the success of my indirect pulp cap. And then after that, after using Biodentine as a bulk, I place the final restoration. One more little detail, one more that is important. With Biodentine XP, which came to the US not too long ago, I was one of the first ones to use Biodentine XP in the United States. We have a better control of the amount of the material that we use. Yes, I do the final restoration in the same session. I don't want to say always because I will be lying to you. Sometimes there are factors who I need to account. Patient behavior is probably one of the factors. Usually, more than 90% of the time, at least that's always my goal, is to complete the restoration the same day that I use Biodentine. In pediatric dentistry, I prepare the patient. I tell the patient that I'm going to use a material that is very critical to keep it dry. And usually during the time that I wait, I have always the same story to tell the patient. I talk about, last night I went to the park to walk my dog, and I always tell that I saw a big deer. And I have a whole story prepared because the deer is going to talk to me, and the kid is really interesting to listen to the story of me talking with the deer. I have a story prepared that I said that 3 to maybe even more than 3 times a day, that I'm using the story during the time that I'm waiting. Seriously, I don't see any issues waiting the 12 minutes. Remember, behind the 12 minutes is the success of the indirect pulp cap. So if I shortcuts, if I waiting, I start to wait 2 minutes, well, maybe I'm going to put in some potential issues the material that I'm using. Pediatric dentists, we practice differently in the US. As you can expect it, we have, pediatric dentists in Europe or in France or whatever. In the US, we have a team behind us, which means is in the US, we have, and obviously here in Europe, we have dental assistants, and we have somebody in the US that we call the expanded functions dental assistant. So usually the impact in my flow is minimal Because if I need to wait the 12 minutes, I can bring my expanding functions dental assistant to the operatory, be with the patient if I really need to stand and go to a different chair, and then she will make sure that, the field is still dry. And so we always, in my office, we have a whole team who helps me to keep the workflow. It means everything. It means everything. I need to add something to your question. Can I? You say, what means for you a satisfied patient? I need to say, what means for you a satisfied patient and parent? Because I don't work with patients. I work with patients and parents. But I explain the material that I use, and I explain what we are going to do. And I explain, and I usually use a draw, and I explain what is an indirect pulp cap. And I explain why I'm trying to do an indirect pulp cap. And I explain that we are trying to avoid, and using very simple terms, I explain to the parents what is biodentine. And I love to say it's a dentin substitute. I love when I tell the parents I'm using the best available material that we have in dentistry for the treatment that we are going to do. I tell the parents, you are not going to find a better material than the material that I'm using with Jose, your son. You are not going to find that. Then later on, 6 months later, when the patient comes back, a year later, when the patient comes back and we take a radiograph and we follow, and the patient is asymptomatic, we don't see that the decay progress. We don't see any radiographic signs. I love it. I save a tooth. I'm not a heart surgeon. I can imagine a heart surgeon, I save a heart, but still, I save a tooth. I love biodentine. I really love it.